Tuberculosis, an ancient foe, continues to cast a long shadow over global health. It affects millions. It disrupts lives. Yet TB does not affect all equally. Gender disparities, often hidden, play a significant role in shaping TB outcomes. Understanding these disparities is crucial for effective TB control. In this exploration, we delve into the intricate relationship between gender and TB. We will use powerful tools: problem tree analysis and solution tree analysis. These tools help us understand the complex interplay of factors driving these disparities. Our goal is clear: to move from data to action. We aim to identify the root causes of gender disparities in TB and explore practical solutions.
Imagine a tree. Its leaves are wilting. You can't just treat the leaves. You need to understand the roots. Problem tree analysis works in a similar way. It's a tool that helps us dig deep. We can then uncover the underlying causes of a problem. Think of it as a cause and effect diagram. The problem is the trunk of the tree. The causes are the roots. The effects are the branches. By understanding these connections, we gain valuable insights. We can then develop effective solutions. Let's break it down into steps. First, define the problem. Clearly articulate the specific gender disparity in TB we want to address. For example, women have lower TB case detection rates than men. Second, identify root causes. Brainstorm potential underlying causes. These could be socio-cultural norms, economic factors, or healthcare system barriers. Third, determine effects. Explore the consequences of the problem. These might include delayed diagnosis, increased transmission, and poorer treatment outcomes.
Visualizing complex problems can be incredibly helpful. Think of a map. It guides explorers through unfamiliar territory. A problem tree diagram acts in a similar way. It helps us navigate the complex web of factors contributing to gender disparities in TB. Let's imagine we're looking at a problem tree. At the top, representing the leaves of the tree, we write our problem. Women have lower TB case detection rates than men. This is what we observe. Moving down the tree, we reach the trunk. Here we might find contributing factors like limited access to healthcare or lack of awareness about TB symptoms. Finally, we arrive at the roots of our tree. These are the deepest, most fundamental causes. They might include poverty and economic inequality, social norms that discourage women from seeking healthcare, or gender-biased healthcare practices. Now that we've mapped the problem, we can begin to envision solutions. This is where solution tree analysis comes in. It's the next step in our journey. It's about transforming challenges into opportunities. Think of the solution tree as a mirror image of the problem tree. For every root cause identified, we brainstorm potential solutions. If a root cause is lack of awareness about TB, a solution might be community education campaigns targeting women. The solution tree helps us generate ideas, identify opportunities, and develop strategies. Solutions should be tailored to the specific context. By working our way up the solution tree, we move from addressing individual problems to creating systemic change.
Section 5. A case for action turning insights into interventions. Let's take a specific example to illustrate how we transition from analysis to action. Imagine a community where women face significant barriers to accessing TB care. Through problem tree analysis, we've identified several root causes. Many women cannot afford transportation costs to reach distant health facilities. Cultural beliefs discourage women from seeking health care without permission from male family members. Women often lack information about TB symptoms, transmission, and available services. Now let's use solution tree analysis to brainstorm potential interventions. Provide financial assistance for transportation to and from health facilities. Offer free TB testing and treatment services. Conduct community dialogues to challenge harmful gender norms. Empower women to make decisions about their health. Launch targeted educational campaigns using radio, community theater, and local influencers. Distribute culturally appropriate information materials. By taking action based on our analysis, we can begin to dismantle the barriers that prevent women from accessing quality TB care.
Section 6. Data's power, illuminating the path to equity. In the vast universe of information, data shines like starlight. It guides our understanding. It illuminates the path towards equitable TB care. But data is not just about numbers, it's about people, it's about stories. Gender disaggregated data is particularly crucial. This means collecting and analyzing data separately for men and women. This allows us to identify disparities, understand root causes, and develop targeted interventions. Collecting this data is just the first step. We need to analyze it, interpret it, and translate it into actionable insights. By using data wisely, we can shine a light on gender disparities in TB and create a more equitable and just future for all.
Section 7. Gender-responsive action, tailoring solutions for impact. Imagine a tailor carefully crafting a suit. They take precise measurements. They consider the wearer's unique shape and style. Gender-responsive action requires a similar approach. We need to tailor our solutions to the specific needs and experiences of women and girls. This means moving beyond one-size-fits-all approaches. It requires understanding gender roles, addressing barriers to access, and promoting female leadership. By tailoring our solutions to the unique needs of women and girls, we can maximize impact. We can create lasting change.
Section 8. Bridging the gap, ensuring equitable access to care. Imagine a bridge connecting two sides of a river. Equitable access to TB care is like that bridge. It connects everyone to the services they need, regardless of gender. Building this bridge requires a multifaceted approach. We need to address both physical and social barriers to care. This includes geographic accessibility, financial accessibility, and cultural acceptability. We also need to consider the specific needs of marginalized groups within the female population. By dismantling these barriers and creating a more equitable healthcare system, we can bridge the gap. We can ensure everyone has the opportunity to live a healthy life.
Section 9. Shifting social norms. Challenging gender stereotypes. Imagine a world where everyone is free to reach their full potential, regardless of gender. Achieving this vision requires us to challenge deeply ingrained social norms and stereotypes that perpetuate gender inequality. These norms often manifest in subtle ways, influencing healthcare-seeking behaviors, decision-making power, and resource allocation. Shifting these norms requires education and awareness, role modeling, and empowerment. By promoting gender equality and challenging discriminatory norms, we create a more just and equitable society. A society where everyone has the opportunity to thrive. A society where gender does not determine one's health outcomes.
Section 10. Measuring progress, maximizing impact. The importance of evaluation. Imagine a ship navigating the vast ocean. Without a compass and a map, it's easy to lose course. Evaluation acts as our compass and map in the journey towards equitable TB care. It helps us track progress, identify what's working, and make adjustments along the way. Effective evaluation requires clear objectives, data collection, and analysis and interpretation. Evaluation is not about finding fault, it's about learning and improving. By embedding evaluation into every stage of our work, we ensure that our efforts are targeted, impactful, and sustainable. We maximize our impact.
Section 11. Towards a TB-free world, a collective endeavor. The journey towards a TB-free world is a collective endeavor. It requires collaboration, innovation, and unwavering commitment from all sectors of society. By working together, we can create a future where everyone has the opportunity to live a healthy and fulfilling life. Addressing gender disparities in TB is essential for achieving our global TB control targets. When we empower women and girls, we empower entire communities. Let us continue to challenge the status quo, invest in solutions, and amplify women's voices. The challenges we face are complex, but not insurmountable. By working together, we can create a brighter future for all. A future where TB is consigned to the history books.